My name is Madison Eubanks, and I will be presenting the views on plastic surgery within our group project. As women of the 21st century, we have been researching self-image and how the world around us influences many women's perception of themselves. Over the past century, plastic surgery has become more prominent in society. More than 2 million women in the United States have breast implants, and this year more than 360,000 women will undergo breast augmentation. What once started during World War I as a tactic to reform the body that was diminished by war has become abused in modern times. Plastic surgery is a key component to degrading women's physiques in the modern world. There are two arguments which contradict one another concerning the views on plastic surgery and how it affects self-image. Specialists such as Dr. Francis argue that there are two types of surgeries which reform the appearance of a person: reconstructive and cosmetic. Reconstructive surgery focuses on deformations which inhibit individuals from functioning on a normal basis. Cosmetic surgery focuses on a normal appearance that is disliked by the individual. This is normally used to improve self-image and confidence. This cosmetic surgery can be used to improve the fitness of a woman, such as reducing breasts which are uncomfortably large for their bodies. This is not always the case. Peer pressure and the media distort the natural physique of women, causing insecurities within their heads. Nobody is perfect, yet plastic surgery encourages the idea that with a few procedures, you can have the fantasy body you have always wanted. This disregards the psychological and physical consequences that follow the surgeries. It is your body, and pressure from the outside sources should not influence your perception of yourself. Celebrities across the world are undergoing multiple procedures in order to gain attention from the media. One celebrity by the name of Heidi Montage, a star on the MTV series The Hills, underwent 10 procedures in one day. She explains to ABS that childhood ridicule and the media's warping of her body on magazine covers pressured her into this decision to change her appearance. The surgeries left her in an emotional struggle with her husband and family, as well as physical pain. Heidi claims that the doctor influenced her by picking out the imperfections and portraying the surgeries as minor tweaks. For example, he pinned back her ears, yet failed to mention that this is one of the most risky and painful surgeries one can have. Which leads to my next point, that along with the media, the surgeons are also abusing this type of surgery. Finally, surgeons may advertise plastic surgery as an escape from insecurities and ridicule, but they forget to mention the psychological effect and physical risks that follow. This brings up the question, is beauty and perfection worth the harmful effects? Some risks to these surgeries are anesthetic complications, infection at incision site, fluid buildup, bleeding, scarring, and numbness from nerve damage. In accordance with the physical risks, surgeries are expensive. The minor surgeries, such as Botox and hair removal, cost $200 to $800, but major surgeries, such as breast augmentations and eyelid tucks, cost approximately $5,000 to $8,000. This is a ridiculous amount of money which can be put to a better use than for the outer appearance. On top of the physical damage, there are also emotional flaws that follow. Insecurities, which drive the ideas for plastic surgery, do not just disappear. There will always be a part of you that you judge critically. Cynthia Fuera-Haas, a clinical assistant professor in the College of Nursing at the University of Florida, underwent a study on the way that plastic surgery helps self-esteem. She interviewed women between the ages of 21 to 57 years old who underwent breast augmentation. Fuera discusses women who had breast changes through age and birth. These women may not feel as attractive, which could ultimately negatively impact their levels of self-esteem and sexuality. Her study showed improvements in women's self-esteem and sexual satisfaction were directly correlated with having undergone breast augmentation. However, Fuer does argue that not every woman is an ideal candidate for plastic surgery, as there will be some women that will never be content with themselves. Therefore, plastic surgery can also have a positive influence on self-image on a woman in modern society. In conclusion, plastic surgery is viewed as a positive and negative influence on self-image. Poor self-image stems from a lot of insecurities, which will always arise. Depending on the individual, it can be helpful with self-confidence, or it may just highlight deeper insecurities. I'll leave you wondering how it may affect the way you view yourself.